The wrinkle eraser Botox has been around for decades now, but it's often thought of as a way to eliminate existing fine lines. But now doctors are using it as a form of wrinkle prevention, and patients are starting to use it in their 20s and 30s. Health reporter Haley Hernandez reveals if beginner Botox is right for you.
I'm good, it's time.
50-year-old Michelle Deutsch has been getting Botox for about 10 years.
It makes you look more refreshed. I think it makes you look like you're rested.
She's a runner and spends lots of time in the sun. She regrets not starting Botox sooner.
I just kind of feel that the Botox is amazing and it works really, really well. I realized that, you know what, it's time to be more preventative with this, more proactive and taking care of it and really keeping up with it.
You ready, Michelle? Go ahead and ice. If you take care of problems on the front end, there's a lot less work on the back end.
Dr. Sherry Ingraham with Advanced Dermatology says if you wait until the line or wrinkle has been there a while, it will be harder to correct.
You don't want to wait till it's deeply embedded. Deep wrinkles are kind of like scars in the skin.
First-time Botox patient Ha Win is in her early 30s and just started seeing a little line in between her eyes.
I wanted to try to do Botox to try to help straighten that out and kind of smooth out that area.
Frown really hard for me? Alrighty, that's it.
For me to get Botox, it's more to prevent those wrinkles from coming in before it even starts.
33-year-old Lupita Rodriguez has been fighting wrinkles for several years.
I hate the way I just frown and my lines just constantly are always there. The more you wait, the more prominent your lines are going to be in the middle.
Did it hurt at all?
No, a little mosquito bite. I love the way it makes me feel, the way it makes me look, so I just, as long as it's safe, then that's all that matters to me.
There are no conclusive studies to show that Botox is more beneficial when starting earlier in life or even less beneficial when starting later in life. But Dr. Ingraham, who performs this procedure, says there are benefits to regular injections.
We do about 20 units, which is a nice starter dose.
If Botox piques your interest, how do you know if you should start?
A good rule of thumb is when the lines that you have with movement start to stay at rest. It's a good time to go to a board-certified dermatologist and begin the conversation.
And know that it will cost you $200 to $400 per session.
It's definitely worth the price for me. I would just keep doing it.
Dr. Ingraham says the best thing you can do to prevent lines and wrinkles in the first place is to use sunscreen. Look for sunscreen that is SPF 15 or higher and make sure it has broad spectrum protection for both UVB and UVA rays. It will say it right on the front. Also, sunscreen does expire, so check the dates. Haley Hernandez, KPRC, Channel 2 News.